Hello, let's talk gynecomastia. Our next snippet from the UPHI informational series, because you're worth it. Your face is your best visiting card. This is applicable equally to boys and girls. In case of boys, there's an additional requirement, and that requirement is to look strong and fit. Fit is healthy. If somebody has gynecomastia, or commonly called as man-boobs, then he is very conscious of it. It affects the wardrobe that he can choose. His self-confidence dips. It restricts the kind of physical activity or the games that he can play. For example, he avoids going to the swimming pool. Fortunately, it is easy to correct. With a small effort, it gives huge dividends. Gynecomastia is of the breast gland, present both in boys and girls. At the time of puberty, the hormonal changes which happen in the body can build up this gland. Most of the boys, the hormonal activity subsides shortly and the gland comes back to normal. It's in a very small percentage of people that the gland can persist, which makes it look like man boobs. A second is if they put in a lot of fat on their body, the fat also gets accumulated and makes it look like man boobs. As I said, at puberty there's a huge overplay of hormones which quieten down by the time the teens are over. So we would like those hormones to settle down. So once you are past your teenage, we'll be there to help you. As I told you earlier, gynecomastia can be from two reasons. One is the gland and one is the fat. If the gynecomastia is gland, then exercises will not alter that. If it is because of fat, you could do all your weight reduction techniques, mostly aerobics, which will take away the fat and also the fat of the man boob area. Though I must warn you, that's a little more stubborn. The rest of the fat goes earlier, the man boob goes a little later. A thorough clinical examination, which I would be doing for you here, will tell us whether you have fat or gland. In case of any doubt, we'll also do an ultrasound to see how much of a gland and how much of a fat. And yes, we will be doing some blood tests to evaluate that your hormonal levels have settled down. The treatment is surgical. We have to reduce the fat if there's additional fat, which can be done with a simpler procedure called liposuction. But in my experience, there's always an element of gland also. So with a small incision made around the nipple area so as to camouflage it, we remove that additional amount of gland to make the manly chest flat and strong looking. Surgery is done under anesthesia. Today anesthesia is very, very safe. The surgery could take about an hour or an hour and 15 minutes for both the sides. Depending on the fat, we can reduce the amount of fat by liposuction initially and reduction of the fat with a small cut next to the nipple so that the scar is well camouflaged. This is a daycare procedure After you recover from anesthesia, we normally keep you here for 3 or 4 hours to ensure that all the anesthetics have gone out of your body, and technically you could go home after 4 hours of anesthesia. So it could be called a daycare procedure. In some patients who would like, we can also keep them here overnight. We have very potent methods of controlling physical pain. We could ensure that you don't have pain. Yes, there may be a little bit of discomfort of the surgery. Liposuction is through puncture holes, so there's hardly a scar to see. For removing the gland, we ensure that we put the scar right next to the nipple, so that it's at the junction of the darker skin and the lighter skin, so that it is well camouflaged. Before surgery, we will ensure what are the kinds of allergies you have, what medications you're on, and we will be doing a couple of blood tests for your hormonal levels and to make surgery fully safe for you. When you come out of surgery, you will have a tight strapping on your chest. 2 days later, we will change that and make you a customized pressure vest. That customized pressure vest you have to wear for about 6 weeks, so that the skin of the gynecomastia sticks nicely and you get a properly shaped breast. Because we are doing surgery just above the pectoral muscles, I'm sure you know what is pectoral muscles, we would like you to restrict gymming for about 2 weeks so that the tissues settle down, and thereafter you can do all the exercises. But having said that, you could start your aerobics or walks within 4 or 5 days after the surgery. After the surgery, we will like you to take rest for about 48 hours. So let me work it out like this. You come in surgery for a Friday, you can be back in office on Monday. Thank you.